Mr. Work and the management and the staff of their core hotels, Liz Kennedy from QKids, Dr. Kado. I'm glad to see that he's been still very strongly part of this program. This morning it gives me great pleasure to be here. As Dr. Kado had mentioned, one of the things that we want to ensure in the ministry is to make sure that people have access to the services that we have. A lot of times in the past, we had people come to the center, come to our major hospitals. Now, with this facility, thank you to Accor Hotels and everybody that's been involved, we will be able to raise accessibility to service, to take the service to people. That's why I'm very glad to be here this morning to launch the Rheumatic Heart Disease Mobile Clinic that will bring life, that will bring service to people all over the country. In mid-2015, the Ministry of Health and Medical Services formalized its relationship with Cure Kids New Zealand as partners and as co-founders on the next phase of the Rheumatic Heart Disease Control and Prevention Program for Fiji. The New Zealand Partnerships for International Development Fund is a major contributor to the program, along with the technical support provided by international rheumatic heart disease experts from Australia and New Zealand. Since 2008, Cure Kids Fiji has supported the rheumatic heart disease activities through funding support from Foundation key partner Accor Hotels and other key supporters, including the Fiji Water Foundation. This project provides 4 years of funding to strengthen rheumatic heart disease initiatives with the aim of reducing the impact of rheumatic fever and rheumatic heart diseases in Fiji. It builds on the initial work of the Fiji Rheumatic Heart Disease Control Program established in 2005, providing a unique a new opportunity to fully integrate and establish rheumatic heart disease prevention and control activities at the highest level nationally. Rheumatic heart disease is a common heart condition in Fiji. It follows streptococcal throat infections and rheumatic fever. Rheumatic fever is an illness commonly seen in children and young adults in Fiji that can lead to heart valve damage. Rheumatic heart diseases causes significant morbidity, disability, and mortality through childhood and into early adulthood. Fiji and surrounding Pacific countries have the highest prevalence of rheumatic heart disease globally, with an estimated 1% of children and young people affected. This is equivalent to approximately one child in every classroom. One child in every classroom. Rheumatic heart disease exerts a significant financial as well as human toll as a result of loss from the workforce of people in their most productive years due to death or disability and expensive cardiac procedures. In response to a need for improved diagnosis of rheumatic heart disease, the RHD mobile clinic that we stand in front of this morning has been custom built for undertaking echocardiograms of the heart in the community. This is a simple procedure that provides images of the heart and enables a specialist medical officer to detect cases of rheumatic heart diseases, in some cases before there are any symptoms showing. The mobile clinic will be used to raise awareness. The vehicle displays an important message that has been expressed by Dr. Kado. Sore throats can cause heart damage. If your child has a sore throat, tell your nurse or doctor straight away so something can be done about it. Funding for this mobile clinic was a direct result of a fundraising partnership between Cure Kids and Accor Hotels. Over a 10-year period, Accor Hotels have raised over $2 million. $2 $2 million for Cure Kids-led child health initiatives in Fiji. Most of these funds have been raised by teams of Accor hotel staff from across Fiji, Australia, and New Zealand, competing in the biannual Accor Hotels Race to Survive for Cure Kids Fiji. In 2014, the event raised over $600,000 for Cure Kids Fiji, funding of the Fiji Rheumatic Heart Disease program, and the 10-year anniversary event will be held on November 2016. We are delighted that this mobile clinic, which wouldn't be possible without this support, can be launched here at Accor Hotels, at the Sofitel, and the staff who have helped fund it can experience the significance of what their efforts have enabled. Over the next 4 days, close to 400 children from local communities are being screened for rheumatic heart disease as part of an ongoing program of work assessing the feasibility of rheumatic heart disease screening program. This mobile clinic that we launched today is an example of the significant investment being made in building the capability of the Fiji Islands Rheumatic Heart Disease Control and Prevention Program. The organizations involved in this program all have had a long association and relationship collaborating with the Fiji's Ministry of Health and Medical Services in Child Health Program. This initiative with Cure Kids New Zealand and partners, including Accor Hotels, the Ministry of Health is undertaking provides a meaningful opportunity to tackle rheumatic heart disease in this country. With this in mind, I would now like to officially launch the Rheumatic Heart Disease Mobile Clinic. Congratulations and thanks to all that are here today for their valuable contribution, and we look forward to this clinic making a significant impact on the lives of our children and the lives of the families of the people of Fiji. Navaleko.
All right, with this scissors, I officially cut the ribbon. Go.
Like this now, and because of the ultrasound it's showing us the different layers of the heart, so we can actually see this bar represent right there, which is the septum, and then so the heart is sort of lying this way at the moment. This is the left atrium, which collects the blood coming back from the lungs, and that's the valve, the mitral valve. Comes into the left ventricle and then gets pumped out the body through the aortic valve.